Computer. There we go. We're live. Good afternoon, everyone. My name is Mercedes Witowsky. I'm the Executive Director at the New Jersey Council on Developmental Disabilities. Welcome to today's bipartisan Legislative Disability Caucus session focused on supporting agencies' perspective on budget uncertainty as it relates to people with disabilities. Closed captioning and sign language interpreters are available, and this session is being recorded and will be available along with all previously recorded sessions on the caucus webpage. On that webpage, you'll also be able to locate the legislators who are Disability Caucus members, as well as supporting organizations. You can sign up for mailings and submit comments or questions on any topic, including today's topic. Hoping that one of our session organizers will put the link to that page in the chat so it's easily available. Panelists, please remain on mute if you're not speaking, and attendees, it's just a reminder that you are in listen-only mode. Let me start off by thanking all the co-chairs of the New Jersey Legislative Disability Caucus for their commitment to the caucus and to people with disabilities in our state. The four caucus co-chairs are Senate Majority Leader Teresa Ruiz, Senate Republican Leader Anthony Bucco, Assembly Majority Leader Lou Greenwald, and Assemblywoman Ora Dunn. A special thank you also goes out to all the remaining caucus members and Senate and Assembly members of the caucus and the staff whom we see quite a few joining us today. Thank you very much. We gather for these sessions so that caucus members consider the impact of the disability community when shaping all public policies. The purpose of today's meeting is to consider and learn about the ongoing budget challenges at both the state and federal level. Today's discussion will feature the original 13 supporting agencies. Those are what we call the founding organizations of the caucus, who will explain the core services they offer and share their top funding concerns and the potential impact on their organizations and the individuals they serve amid this fiscal uncertainty. These past few months have been challenging for so many individuals with disabilities and their families and the agencies and organizations supporting them. While we do our best to prepare for challenging times and to understand that when we rely on federal and state fundings to operate services and supports, change can happen. Regardless, the struggle is real. Uncertainty creates another set of difficulties. There have been announcements, actual and proposed budget changes at the state and federal level that separately and together present a series of fluctuations and considerations that organizations are struggling with in determining how to prepare and align with the services and supports they provide. Many organizations are facing tough decisions. Many people with disabilities and their families are clearly overwhelmed. Many people with disabilities and their families are trying to understand and process what they hear in the news and what they read about in reports, while still getting up each and every day with the enormous stressors and responsibilities in front of them. For many people with disabilities, especially multiple and complex disabilities, a regular day without proposed changes is daunting. There are interconnected services and supports that for many people take weeks, months, and sometimes more than a year to carefully plan, that literally fall apart when one component is out of alignment. There isn't one person listening today or that will listen to the recording that cannot tell us about a time when things didn't go as planned. We all have had to pivot because the day just didn't go off as expected, right? Like getting a flat tire, waking up with no power, the hot water heater stops working. Just think about the things that face us in life that make for the need to plan for plans to change. For people with disabilities and their families, pivoting becomes a standard and expected way of life. It's just not uncommon to face an obstacle each day, every day, from the caregiver who calls out sick and now you cannot get out of bed, to the accessible vehicle that breaks down, so you have to cancel your medical appointment, to even getting a Medicaid or Social Security redetermination notice in the mail that requires hours and hours of pulling together required documents to comply with notices. Every day is lined with an obstacle, a barrier, and a constant reminder that life is rarely simple. Now we are in the midst of a series of uncertainties from many angles. And just like the caucus is bipartisan, disability is not a partisan issue. Disability impacts 1 in 4 people. And our collective job is to support people with disabilities throughout our state. And we recognize that New Jersey has very strong services and support, a very strong foundation of supports for people with disabilities and their families, and they heavily rely on that. And so we must not and cannot weaken that infrastructure, because bad things will happen. If people with disabilities don't have the means to cover the basic food, shelter, and healthcare expenses, we have failed as a community. If people with disabilities who rely on others to keep them safe and healthy cannot access those caregivers, then again, we have failed as a community. And if people with disabilities cannot develop happy and healthy relationships and live a life that fulfills some of their dreams and aspirations, then once again, we have failed as a community. We recognize that in times of surplus, we should all benefit. And when there are shortfalls, we all must find ways to sharpen our pencils. But people with disabilities live on the tightest of margins, and sharpening their pencils means they don't eat, they can't access healthcare, they fall behind on their bills, become evicted, and worse situations, become homeless or institutionalized. We cannot let this happen, and we must watch closely and pay attention to every state and federal budget decision so that we do not erode the infrastructure that protects our most valuable family members, friends, and neighbors. We are fortunate to have some of the most amazing organizations in New Jersey that are dedicated to providing services and supports, many operating 24 hours a day so that people with disabilities and their families have access to what is needed to live their best lives. And I will introduce the organizations joining us today. And if legislators or staff have questions or comments as you hear from the series of speakers, please raise your virtual hand and we will make sure to get to you as we proceed with the remainder of our meeting. First up, I'd like to introduce Paul Aronson, who's the Ombudsman for individuals with intellectual or developmental disabilities and their families.
Thank you, Mercedes. Thank you to you and the council and legislative partners for organizing this important meeting and this very timely discussion. And thanks to all the founding partner organizations. I'm looking out on my screen and I can see folks, and you know, we serve this community, the disability community, each in our own way. And I know all of us are feeling a lot of pain and a lot of concern, a lot of anxiety lately. And I think, Mercedes, your opening comments were spot on, and I want to thank you for that. Real sort of scene setter, because these are trying times. And, you know, trying times for the organizations represented here, but more importantly, as we'll all agree, for the individuals and the families that we serve. As you said, Mercedes, you know, the people we work with, we work for, the people we serve and support, often their lives are challenging on a good day. And, you know, what's happening in terms of budget constraints and other concerns that are happening both locally as well as nationally are just adding anxiety, adding concerns, and adding to the hardship that so many of the individuals and families throughout our state are facing. Uh, as you know, so I've been New Jersey's ombudsman now for 7 years. This month is my 7th anniversary. And as you all know, it's a relatively new office in state government. It was created by the state legislature in December of 2017. It was signed into law by Governor Chris Christie in January 2018, and I was appointed by Governor Murphy in April 2018. And so we've been operational for about 7 years. And it's an office that was born out of the recognition that here in New Jersey, we have a lot of supports and services for children as well as adults with intellectual and developmental disabilities. But it's a very complex system, and it can be overwhelming for folks, for the individuals and the families trying to navigate the system with these lifespan disabilities. And so our office tries to be a resource. We try to help families sort of connect them with the services and supports that they need and deserve. And again, we work with folks of all ages, different disability types across the entire state. And perhaps not surprisingly, as you all know, folks tend to come to us when there's a concern, when there's a problem, when they're having trouble navigating a situation. Oftentimes we deal with folks that are in time-sensitive situations or even in crisis. And so, we deal with folks, in difficult moments. And so against that backdrop, when I think about, what concerns us most, we have concerns obviously on the state level, the budget constraints, and we've seen the governor's budget proposal, and there's some organizations that have seen proposed reductions in their budgets or eliminations. And that's very concerning. And we work with these organizations closely. I'm thinking I don't want to name them because I'll miss them, but particularly Centers for Independent Living, that serve folks, throughout the entire state and communities throughout the state. There's the Community Living Education Project. There's the Community Health Law Project. I mean, there's so many organizations. And so we stand by them and want to work with them as they try to navigate this difficult budget moment. But our biggest concern, and I think probably shared by everybody or most people on this meeting today, is Medicaid and the future of Medicaid. I mean, I guess the term lifeline seems to be a little overused these days, but it's true. I mean, we all know it. Medicaid is a lifeline here in New Jersey for 1.8 million New Jerseyans who rely on it. And not just for access to critical health care, but for so many folks, it's access to critical sort of supports and services that make living in the community safe and possible. And so we, like so many of our colleagues on this call today, are very concerned about this and doing what we can to sort of advocate and to get the message across to legislators who may not realize it in Washington, that it's not just a health program, which in itself is important, but it's much more than that for so many people. And, we're also concerned because, any cut in Medicaid will not only impact, the folks that rely on Medicaid and their families, but it'll have a devastating ripple effect throughout the entire state and throughout the entire economy. So that's sort of first and foremost on our minds. The last thing I'll just say is, we stand ready to work with any of our partner organizations, legislators, and of course the council on any of these issues. And again, thank you for having today's important conversation.
Thank you, Paul. We are all resources, and I should have mentioned that earlier. Every organization that you will hear from today are resources and partners with legislators, and I know you rely upon them. So we're grateful that they've joined us and are going to share out with us. Next, I'd like to invite Sharon Levine from the ARC of New Jersey.
Good afternoon, everyone. Thank you, Mercedes, for the opportunity to contribute today's really important conversation. And I really just want to take a moment to thank the legislators who are on this call who continue to support people with IDDs and their families. We count on you. We appreciate you, especially as we face these unknowns on the federal level and the concern and fear that that's causing for the individuals and families that we represent. The ARC of New Jersey, we are the state's largest advocacy organization for people with IDD and their families, and we have 20 local county chapters of the ARC that provide the hands-on services in every county across the state. I'll start on the state level, where we are thankful to Governor Murphy for including 2 critical items in his proposed budget. That includes money to increase direct support professional wages in order to stay ahead of the state's rising minimum wage, and funding to move more than 300 people off the waiting list, which is a critical priority. This is so important to families who are waiting for increased care. Unfortunately, there are 2 cuts in the proposed budget that will have a negative impact on people with IDD and their families. The first is about approximately $500,000 cut to the ARC of New Jersey's Planning for Adult Life program. With this program, we're able to help students with IDD and their families navigate next steps after their educational entitlement ends. And this is such an important program. We hear from families often that when the school bus stops showing up, their young adult is left sitting on the couch without a path forward for what happens next, that they fall off the cliff. Our PFAL program helps to prevent that outcome. This year alone, the program assisted more than 7,000 students between the ages of 14 to 21. Our adult system, it can be complicated, and PFAL really helps students navigate the process of obtaining Medicaid and services from DDD, learning how to use public transportation, determining what type of employment would be the best fit for them, and thinking about housing options and paths for being independent. PFAL leads students and families through this transition so that they don't fall through the cracks, they don't fall off that cliff. It's an essential program, and it's assisted generations of students. And so that funding being cut from the budget is just really going to be very difficult for students when they don't have somewhere to go to get that help. Also cut from the budget was almost $300,000 from the ARC of Monmouth's Primary Care Center. That funding enables the ARC of Monmouth to deliver psychiatric and behavioral health services to more than 500 patients who have both IDD and psychiatric and behavioral health challenges. And these are really services that can't be easily replicated elsewhere. This population has complex and unique needs, and some of the individuals served also have, communication difficulties, which can make treatment more challenging. The practitioners at the health center are really trained and experts in this field. There are very few practitioners who are educated and experienced enough to serve this population. People travel across county lines to go to the ARC of Monmouth, and we really don't know, if this funding isn't reinstated in the budget, what's going to happen to these individuals. Where will they get this care? It's not something that they can just go down the street and get elsewhere. So it's so critical to the families and the individuals who rely on it. And then as the speakers before me have talked about, any cuts to Medicaid will just have a devastating impact on our state budget and on the people who rely on Medicaid. I just can't even imagine. So anything that we can do to prevent those, certainly that weighs heavily on the minds of those we represent. So thank you again, Mercedes, for the chance to just share a little bit from our perspective.
Thank you, Sharon. Thank you again, all of our speakers today and all of our legislators and staff joining us. It's really a critical conversation. Next up, I'd like to invite Devin Baker from Autism New Jersey to share with us. Thanks, Devin.
Hi, everyone. Good afternoon. My name is Devin Baker, and I am the Deputy Public Policy Director for Autism New Jersey. We drive statewide change to make New Jersey more autism friendly and create connections for parents, professionals, and policymakers. Thank you to the New Jersey Legislative Disability Caucus and Mercedes specifically for inviting us. It's really a pleasure to be here with each and every one of you today, especially as a former legislative staffer myself, who recognizes there are many different angles at play here. So first, I would like to echo what a lot of us agree on here, which is that, funding for DDDs, home and community-based services for adults through Medicaid and special education services are a huge priority. But since I only have a couple minutes, I will hone in on one of our current priorities, which is improving autism service delivery to New Jersey's underserved communities, specifically the services associated with EPSDT. So as a reminder, EPSDT, which stands for Early and Periodic Screening, Diagnostic, and Treatment, is a Medicaid entitlement that provides access to comprehensive, high-quality health benefits for youth under the age of 21. Just for some background, the most recent New Jersey Family Care Monthly Enrollment Report has the total number of individuals under 21 at over 890,000. So that includes those with disabilities and those without disabilities. So we estimate, based on the new prevalence rate, that about 12,000 of this population have autism and an intellectual disability. I'd also like to take this time to share a quick story from our end, based on our helpline that we recently received. So the parents of a 3-year-old, and for privacy reasons, let's call him David, from Morris County, reached out to our 804 autism helpline. The recently diagnosed son had been exhibiting increasing challenging behaviors, including property destruction. He has been expelled from 4 daycare programs for aggression, kicking, and screaming, all of which are symptoms of his autism. The parents, both of whom work full-time jobs, cannot find appropriate childcare. They feel that ABA therapy would help address this behaviors and give them the tools they can share with prospective childcare providers and avoid his expulsion. However, after calling all ABA providers in their area, the shortest wait list they have found is still an 8-week wait. And 8 weeks may seem like a long time, but 8 weeks is actually on the shorter end of wait times, as we found that most wait times can be months long. The father is now facing termination from his job due to the time off he must take because of the lack of appropriate childcare. So when I talk about our underserved communities, I am generally referring to both the urban and the rural parts of New Jersey that experience major network adequacy issues. These areas don't have enough providers close enough to properly serve them. Many of the providers in the areas don't accept Medicaid or are too far distance-wise for parents and caregivers to get to. This lack of availability means children and teenagers with autism can't access medically necessary treatment within a reasonable amount of time. So these issues often come down to Medicaid reimbursement rates, which, as we know, are on the lower side. We need more established service providers to enroll in Medicaid, and we need more Medicaid providers to set up shop in these underserved areas. This can be accomplished by raising Medicaid rates and attracting providers to serve children with autism who rely on Medicaid to access medically necessary treatment. I understand that right now we are in survival mode as we fight to stop potential cuts to Medicaid, but let's not forget that the current funding is inadequate to meet the autism community's treatment needs, especially in underserved communities for kids like David. Autism New Jersey stands ready to work with you all to preserve these essential entitlements. Thank you again for having me, and I'll pass it back to Mercedes.
Thank you, Devin. Such important issues from Autism New Jersey. Next up, let's ask Colleen Roche from the New Jersey State Independent Living Council to join us. Colleen.
Good afternoon, Mercedes. Thank you. And good afternoon to our elected officials that have gathered here today. Thank you for joining us today. My name is Colleen Roche, and I live with a disability. As the chair of the New Jersey Statewide Independent Living Council, I'd like to briefly share with you the devastating impact that zeroing out the $3 million line item for the Centers for Independent Living in the FY26 state budget will have on your constituents with disabilities. CILs are nonprofit organizations run by and for people with disabilities. They are consumer-controlled, community-based, cross-disability, non-residential agencies that provide independent living services that include, but are certainly not limited to, information and referral, independent living skills training, peer counseling, individual and systems advocacy, as well as services that facilitates people's transition from nursing homes and other facilities back into the community. The state's 12 CILs serve people with all types of disabilities across the lifespan in every county and have truly been exceptional stewards of the funds allocated to them through this line item. In the last year alone, CILs have provided over 102,000 consumer services. Each center is a trusted resource in their area, and daily they provide essential supports that allow disabled people who may otherwise not be served by other organizations and state entities to fully contribute to their communities of choice. The line item has allowed centers to expand their programming to meet the needs of their consumers, particularly those in the most underserved areas of each county, in truly innovative ways, including enhancing peer support groups, health and wellness activities, and mental health services. Additionally, a mobile CIL and a robust food security initiatives throughout the state have been successfully implemented. This cut is an approximately 45% reduction of funds across the centers. Programming and staffing will need to be reduced, which will directly affect center employees, including those with disabilities, as well as the thousands of individuals and families who depend on the unique services the SILs offer to maintain people with disabilities, to help maintain their independence and well-being. As it has been said before, 1 in 4 New Jerseyans, that's 25% of each of your constituencies, live with a disability. It's the only demographic that anyone can join at any points in their lives, and the SILs are here to serve everyone. Given the fiscal uncertainty at the federal level, restoring this line item not only makes sense, but will continue to be a cost savings to the state by equipping people with disabilities with the independent living skills and supports they need to be contributing members of their communities. And the New Jersey Statewide Independent Living Council stands ready to work with any legislator that is in support of maintaining all of the services and supports that you're hearing about today. Thank you so much.
Thank you, Colleen. I'm going to, just in case folks joined us recently, as we go through the original supporting organizations and founding organizations of the caucus, I would like to remind our senators and assembly individuals to please raise your hand if you have a question or a comment that you'd like to make as we're moving through the rest of the speakers. We want to make sure that you have an opportunity to engage, when you have a question. So I will look for that virtual hand raise. Next, I'd like to invite Colleen McLaughlin from the Boggs Center on Disabilities and Human Development at Rutgers Robert Wood Johnson Medical School.
Hi, everyone, and thanks for joining us today. Like Mercedes said, I'm Colleen McLaughlin. I'm the co-director of the Boggs Center on Disability and Human Development at Rutgers Robert Wood Johnson Medical School and the director of our University Center for Excellence in Developmental Disabilities, Education, Research, and Service. I'd first like to state that we are thankful for the critical state and federal partnerships that make these essential programs available across multiple departments within the state and federal level. As some of you may know, along with, there have been dozens and dozens of programs important to the disability and healthcare communities, some of which are on this call today that have been slated for elimination within the Federal Department of Health and Human Services leaked budget to the president. Both of our federally legislated programs that are focused on capacity building within the state have been slated for elimination according to this leaked budget, and the leaked budget for the federal fiscal year 26 budget to the president. And I'm going to go over what some of these important programs are. So the first program I'd like to bring up is our Leadership Education and Neurodevelopmental and Related Disabilities program that is directed by my colleague, Dr. Carrie Caulfield. This program, known as LEND, is authorized through the Autism Collaboration, Accountability, Education, and Supports Act, also known as the Autism Cares Act. And it is designed to provide interdisciplinary education that is focused on the integration of services. It provides health professional skills that foster community-based partnerships, and it promotes innovative practices that promote community-informed, family-centered care and interdisciplinary partnerships. The goal of this program is to improve the healthcare delivery systems for children with autism and other developmental disabilities. New Jersey LEND is a primary workforce development program that provides training for graduate level fellows, as well as continuing education to practicing professionals, people with disabilities, families, and it also provides technical assistance. It is frequently the only form of education that interdisciplinary trainees, which are future allied health professionals, receive in using academic avenues. There are so many students that don't receive any information about disability that they can use to inform their future practice. Since its inception in 2024, New Jersey Lend has trained over, actually coming this year, it'll be over 150 long-term fellows for more than 300 hours across more than 11 disciplines, which include advocacy, dentistry, family, genetic counseling, medicine, nursing, nutrition, occupational therapy, psychology, public health, and social work. So as you can see, we touch the majority of the allied health professions through our New Jersey Lend program. The other program that I could speak to probably most fluently is our University Center for Excellence in Developmental Disabilities. The UCED is, we are New Jersey's federally designated UCED, and we are authorized by the Developmental Disabilities Assistance Bill of Rights Act, known as the DD Act. As you said, we serve as a bridge between the university and the community, and we are a trusted resource. We're considered the knowledge engine of the DD Act network, and we provide a variety of services, the first of which is training and technical assistance, the second of which is information and publication and dissemination. The third is research focused on intellectuals and developmental disabilities, and also interdisciplinary pre-service preparation and education with students. Our expertise within our faculty and staff cover an array of topics, which are demonstrated through those core functions that I just mentioned. We provide a wide array of training to professionals, families, and people with disabilities on the topics of behavioral and mental health. We cover every topic almost under the sun when it comes to direct support professional workforce development. We also provide education to teachers across the state on a variety of special education and post-secondary success topics, employment for people with disabilities, health and well-being, and inclusive community-based supports. I know I'm getting the hook here, so I just want to sort of emphasize that the collaboration between state legislators, the governor's office, and their federal legislative counterparts is going to be essential to emphasizing the value and importance of all disability programs to assure that New Jerseyans with disabilities can live the active, valued, and productive and included lives that they deserve. So thank you, everyone.
Thank you, Colleen. Next up is Gwen Orlowski with Disability Rights New Jersey.
Good afternoon, everyone, and thank you so much for inviting Disability Rights New Jersey here to speak with you today. I echo what everyone before me has said about how important it is to have this opportunity to talk to you at this moment in time. So again, my name is Gwen Orlowski, and I'm the Executive Director at Disability Rights New Jersey. I'm glad to go after Colleen because we're the second of the DD partners under the DD Act that Colleen mentioned. And as I said, we're the designated protection and advocacy for the state of New Jersey. The DD Act has its origins in a documentary made more than 50 years ago about a developmental center in New York called Willowbrook. And the conditions there were so horrific, it caused Congress to act. And initially, the protection and advocacy function existed in state government here in New Jersey in the first iteration of the public advocate. And in 1975, Governor Christie Todd Whitman designated Disability Rights New Jersey as New Jersey's protection and advocacy agency. We are a nonprofit, and as is true in most states now, all but for the protection and advocacy function exists outside of state government in a nonprofit. Everything that we do emanates from a series of federal protection and advocacy statutes. We're sort of a unicorn, I think, because we're a nonprofit, and yet we have this authority from federal law. It gives a patina that we're somehow akin to a state agency, even though we're not. And I'll go through the functions that we fill under federal law. First, we have the authority to monitor any setting where a person with a disability is getting a service. So if you're familiar with the long-term care ombudsman, it has a function that's akin to that, right? We're boots on the ground. We're in nursing homes, developmental centers, state psychiatric hospitals, group homes, you name it. we can go in to monitor to ensure people are free from abuse and neglect and that their rights are being afforded to them. We also have the authority to conduct investigations of abuse and neglect when we have probable cause. And that investigatory authority is really significant under federal law because in addition to being able to go in and conduct that investigation, we have broad authority to access records. So we can really uncover and find out what is going on to prevent abuse and neglect. And then our next major function under federal law is that we have authority to engage in legal advocacy. And that involves policy advocacy, but it also involves legal representation. We're a law firm embedded inside of Disability Rights New Jersey, and we provide individual representation as well as systems changing representation. To give you a sense of the number of clients we serve through that investigation and legal mechanism, we served 900 people in 2024. We also do information and referral, and in 2024, we provided information and referral to 1,700 people. I'll turn now to two issues that are particularly compelling. The first one you've heard from others, our Medicaid defense work, our Protect Medicaid initiative. We have a fact sheet, which I'd be happy to share. It's also on our website, but it gives a snapshot of how devastating proposed cuts to Medicaid would be for the 1.8 million people in New Jersey that are in the Medicaid program. The Medicaid, we receive federally $14 billion to support that program. And of that 1.8, 300,000 are older adults or people with disabilities, and more than 130,000 of those receive long-term services and supports, the things that other people have already talked about that make it so that older adults and people with disabilities can really live inclusive lives of their own choosing in the community. The second thing I'll just say, because I can see Mercedes now real fast, touching on what Colleen said as well. The leaked information last week from OMB about a preliminary budget for DHHS, which will lead to the presidential budget, is devastating for older adults and people with disabilities. It eliminates many essential functions that we see as necessary to ensure that people are safe and free from abuse and neglect, including the protection and advocacy system, as well as our DD partners, the long-term care ombudsman, and more. It's truly pulling out the safety net of abuse and neglect and rights-based advocacy for people with disabilities. And so, with that, I'll turn it back to you, Mercedes.
Thanks, Gwen. We'll go next to Carolyn Hayer with SPAN Parent Advocacy Networks. Carolyn, thank you.
Thank you so much, Mercedes, and to the council for hosting this event. And certainly thank you to the Legislative Disability Caucus and all the legislators who have joined us today, not only for joining today, but for your ongoing support. It truly matters to individuals with disabilities and their families to know that you are there and that you are listening and involved in our work. My name is Carolyn Hayer. I'm the Executive Director of SPAN Parent Advocacy Network, often referred to just as SPAN. And we are a nonprofit. We're a family-led and family-serving organization. Our primary functions are to provide information, support, training, and advocacy for New Jersey's children and families, most especially for those with disabilities and or special health care needs, or those who are at risk across a variety of systems, including education, health, and human services. In addition to that, we are an organizational capacity building entity. We provide technical assistance to the 92 parent centers and the 59 family-to-family health information centers across the country. Much of our work is either funded directly through federal grants or cooperative agreements, or indirectly via state grants that are through federal funding sources. The impacts of the federal financial potential freezes and the other executive orders are very, very concerning to us as an organization. because it will certainly threaten our ability to maintain our staff and to do our work. SPAN's mission is to empower families, youth, young adults, and to inform and involve professionals and others who are interested in the healthy development and education of children to enable our children to become fully participating members of society and their communities. We have a special focus on those with the greatest need. So our foremost commitment is to individuals who may experience some sort of discrimination, whether it's based on disability, poverty, race, sex, language, or their immigration status. We serve families also within the child welfare and juvenile justice systems. We know how important zip code is, so we know that families are often discriminated against with regard to their geographic location or any other special circumstances. Our organization has 75 full-time and part-time staff, about 200 volunteers. We've trained over 600 parent leaders, and our goal is to make sure that families understand the systems that are designed to serve them, that they have the ability to tell their story and have a voice at the table, and to hope that this has a positive impact and influence on policies that impact families. Our program areas are primarily around early childhood. We have programs around family engagement, as well as health, wellness, and we do this by providing individual assistance and training to families. Most of our work is in the education realm. Our primary funding comes from the U.S. Department of Education. So therefore, we are closely monitoring everything that is happening at both the state and federal level. But one bright light I think we have to focus on in the midst of all of these concerns is that we do know that even though there are many changes to the U.S. Department of Education, we have to note that IDEA is still intact. Families and children are still entitled to those services that are afforded to us under that law. No change has happened, and so we are moving forward, supporting families, assisting families as we always have, and reminding folks that those rights, supports, and services are still available, and to continue to advocate for their children as needed every day. Thank you for the opportunity. It's a pleasure to be here.
Thank you, Carolyn. Next up, we'll invite Shauna Moses from the New Jersey Association of Mental Health and Addiction Agencies. Shauna, thank you.
Hi, good afternoon. Thank you so much. It's so inspiring and uplifting to hear how we have many common ties, common ground, common mission, and I appreciate the opportunity to share NJAMA's role. So NJAMA stands for New Jersey Association of Mental Health and Addiction Agencies. And even though we don't have intellectual and developmental disabilities as part of our already long name, we do focus on that as well, because there is a high, I'm sure all of you know, high prevalence rate of depression, anxiety, other mental health disorders, also substance use disorders throughout the intellectual and developmental disabilities population. Also, our providers primarily do serve the Medicaid population. So we are extremely concerned, as everybody else is on this call, about the potential cuts, the huge threat to Medicaid funding. Another part of our name that doesn't really, we can't fit it all in the name of it. But although we represent providers directly in our advocacy on the state and federal levels, ultimately we are advocating for the people they serve, as our partner organizations here and others do. Because without the strong workforce and the funds to serve everyone in need, without that support for the provider organizations, then the people in need of those services, those needs are just not going to be able to get met. And that need continues to increase long since before long before COVID. We've always had increased needs for services, and that increase has continued to skyrocket since the pandemic, and it's going to be ongoing with other challenges in the world, in our reality. So those services are so invaluable, and the more resources we can get, Medicaid and others, the better. I also want to reinforce that in the state and federal budgets, so in addition to preserving Medicaid, the rates for all reimbursement has long been insufficient for many, many years. The cost of care has not been met in a very long time, and those costs are also increasing, as well as the demand for those services. So our priorities are to preserve and increase funding as much as possible from all funding sources. We do have a campaign called Untold Stories, Why Access to Care Must Be the Highest Priority. I'd be happy to share the link to that. We encourage everyone to share that in their advocacy on the state and federal levels. We also have a single-page document of our budget and legislative priorities that align with all the major issues that we're talking about today. And I'd also like to briefly mention another part of my work and that of my CEO, Deborah Wentz, who I'm sure all of you know, is with the Governor's Council on Mental Health Stigma. And again, even though IDD is not in the name, we are focusing on that as well. In fact, within the next couple of weeks, we will have a new issue of our newsletter, which is called Stopping Stigma, coming out. And we have a webinar on May 14th. And both of those are focusing on serving people who have both mental illnesses and intellectual and developmental disabilities. I will also share the links to those and hope to see all of you and work with you more on these critical issues. Thank you very much.
Thank you, Shauna. Next up is Tom Grady with the Brain Injury Alliance.
Good afternoon, everybody. Mercedes, thank you for putting all this together. You do a great job as usual. My name is Tom Grady. I'm the Director of Advocacy and Public Affairs for the Brain Injury Alliance of New Jersey. We exist to improve the quality of life for anyone impacted by brain injury by providing support, advocacy, and information, and with the main focus of promoting brain injury in the first place. We aim to realize a world where all individuals with brain injury and their caregivers maximize their quality of life. The consequences of all unavoidable brain injuries are minimized. And again, that all preventable brain injuries are prevented. It should come as no concern or no surprise, I should say, that one of the main concerns of the brain injury community is Medicaid. Particular subset of that is our support coordination program, where we provide care management services to adults 21 years and older who are eligible for DDD services. And we assist those people by finding services and developing individualized plans based on a person's need. In other areas that we are interested in at the federal level, in Centers for Disease Control and Prevention, there's a Heads Up program, which helps people recognize and respond to the people who have concussions and other serious brain injury. There's a return to work program that we want to see maintained at the federal level. Of particular note at the federal level is a program within the Administration for Community Living, particularly the state TBI State Partnership Program. And this is a grant program that promotes access to integrated, coordinated services and supports for people who have sustained a brain injury, their families, and their caregivers. And it should be noted that New Jersey is in fact receiving funds from the ACL, the Administration of Community Living. Also, there is the funding through the National Institute of Disability, Independent Living, and Rehabilitation Research. As the name implies, it focuses on brain injury research. And finally, excuse me, there's a model systems program also that's focused on research, which aims to obtain and provide critical data and treatment to people with brain injury on a long-term focus. Those are the main ideas that we're focused on at the federal level, but again, with special emphasis on the Medicaid piece. Thank you.
Thank you, Tom. Kate Kelly with Supportive Housing Association of New Jersey. Thanks, Kate, for joining us.
Thank you. Thank you, Mercedes, for putting this event together, and thank you, everybody, for your time. As Executive Director of the Supportive Housing Association of New Jersey, I'm here on behalf of our over 110 member organizations and our Board of Trustees. We are dedicated to the creation of permanent, affordable housing with flexible support services for people with disabilities and other special needs. Individuals may live with one or more challenges that include physical, intellectual, or developmental disabilities, but are not limited to those. The variety of individuals who live in supportive housing, one thing that brings them together is their common need for safe and decent housing and supportive services. More people than ever today are living in communities of their choice and receiving the services they need to live as independently as they can. Supportive housing is very much a proven strategy that works, and we continue to need from both the federal and the state, at the federal and both the state level, we need capital funding to build, operating support in the form of rental assistance, and service dollars to allow people with special needs who are currently waiting for housing to finally find their home. We are very concerned about the potential cuts to the federal Medicaid funding, as many of our members serve populations that are Medicaid members, and also the proposed cuts to HUD staff and proposed additional cuts that may be coming to HUD. I'm going to here, though, today talk about state capital funding. We are grateful for the legislature's support last year of landmark affordable housing legislation in New Jersey. Cities and towns across the state are complying and making plans to build affordable housing that will help them meet those obligations. But as in previous years, future capital investment is needed to ensure we have a robust pipeline of affordable homes. We are deeply concerned that the proposed state budget diverts most, if not all, of the New Jersey Affordable Housing Trust Fund for over 80% area median income projects. This fund is explicitly intended for under 80% AMI housing efforts, and now is not the time to drain the Affordable Housing Trust Fund. It's the major dedicated source of funding for affordable homes in New Jersey. We are very appreciative that in the past, the legislature and governor have adopted legislation that dedicates $20 million annually in realty transfer fees for the Special Needs Housing Trust Fund. This funding should be transferred to the New Jersey Housing Mortgage Finance Agency as a dedicated revenue source to continue to allow us to build the special needs housing that we need in the state. In the 3 years since the Special Needs Housing Trust Fund was revitalized in New Jersey from 2018 to 2020, almost 650 supportive housing opportunities were created. And from 2022 to 2024, almost 1,500 apartments were created. This is 130% higher than in preceding period. The budget appropriates an additional $15 million for 2 special needs housing projects, which would bring the total to $35 million for special needs housing. So we're very concerned that, again, the Affordable Housing Trust Fund is funded and that the money is set aside for the Special Needs Housing Trust Fund. It's a dedicated pipeline for supportive housing in New Jersey. Thank you.
Thank you, Kate. Next, Val Sellers with the New Jersey Association of Community Providers. Val, thanks for being here.
Thank you, Mercedes. I appreciate the opportunity, and thank you to our legislators that take the time to learn about who we are and what we do. It is truly appreciated. The New Jersey Association of Community Providers represents 80 agencies throughout the state of New Jersey, serving thousands of individuals. And I have to say, we are truly appreciative to Governor Murphy for not cutting our rates and for even including some funding to allow us DSP wages to keep pace with inflation. I'm also appreciative because Governor Murphy has continued to fund the Direct Support Professional Career Development Program. This is a program that NJCDD NJCP in collaboration with the Council of County Colleges and Bergen and Rowan Community Colleges, where we provide education to those that would like to become DSPs or certified nursing assistants. We've graduated, I think, 40 people from the program. But the program also allows current DSPs to pursue an education through one of the state's county colleges. We've had 218 DSPs inquire about this program. We reach out to them, we provide mentorship, and we connect them to the community college in their geographic region. And we are now able to provide stipends, not only to those that are learning to become DSPs, but also current DSPs that pursue college credit. I was listening to others talk about, we are very concerned with what's going to happen at the federal level. So we can sit here and say we're pleased that funds were not cut from our rates, and we are, but we wait with bated breath as to what will eventually come down from the federal government, because we know that if Medicaid is in any way, shape, or form cut, we've been told that the impact could be catastrophic. So that is what probably the number one concern that we have in this community, while we wait for the federal government to ultimately tell us what they're going to be doing with Medicaid. But the other piece that I think affects all of my members is that we have to ensure that we're not passing legislation in the state that ends up costing the system more. It is a system that's been underfunded since we transitioned to fee-for-service. In fact, it was 13% underfunded. And while we continue to see funds directed our way, and we're appreciative of that, the reality is that legislation that adds cost to the system and impacts access and the ability for providers to expand the system of care, we need to be cognizant of that. And those are our main concerns at this point in time, Mercedes.
Thanks, Val. And next, Kathy Chin, the Alliance for the Betterment of Citizens with Disabilities. Kathy, I hope we can share the last 4 minutes of.
You bet.
Okay.
I'm trained. You know, Mercedes, I can't talk for more than 3 minutes at a time. I've been trained. Good day, members of the New Jersey Legislature, members of the Disability Caucus, Director Witowsky, members of the New Jersey Council on Developmental Disabilities, Ombudsperson Aronson. Thank you for this opportunity to provide you an update on early intervention services. In addition to the provision of day and residential programs and services for adults, ABCD member agencies provide early intervention services, physical, occupational, and speech language therapies for infants and toddlers 0 to 3 with with developmental disabilities or delays. The goal of these programs is to prevent and minimize permanent disability. Though New Jersey's birth rate is stable, early intervention saw 5% fewer infants and toddlers last year than in 23-24. While analyzing the underlying causes, I am happy to report that in the FY26 proposed budget, the Department of Health has added additional resources to Child Find, which is the process of locating, identifying, and evaluating children with disabilities and delays who may be eligible for early intervention services. To achieve this goal, the Department of Health's early intervention staff, which has increased by 40%, that is very, very good news, will work with national and local partners to further innovate the program, work closely with regional collaboratives and the neonatal intensive care units, host community events, and expand the WIC EI pilot in Newark to include Cumberland County. The pilot found that 70% of the families receiving WIC benefits in Newark had not heard of early intervention. Employing the WIC text communication system, DOH has made inroads locating eligible children. In addition to their efforts to increase demand, DOH recommended an increase to provider rates to maintain and increase the supply of PTs, OTs, and speech language therapists. Regrettably, that did not make the proposed budget, but the department fully understands the necessity of increasing capacity to meet its goal of increasing the number of children participating in this life-altering program. And to that end, ABCD is asking for an increase of 2.5% in the rates, $4.5 million state share. In addition to improving Child Find, the state will be focusing on improving child outcomes, the specifics of which are in process. Thank you so much for this opportunity.
Thank you, Kathy. I'd like to just take that last couple of minutes to talk about the New Jersey Council on Developmental Disabilities, which is currently funded through the United States Department of Health and Human Services within the Administration for Community Living. While many changes are being leaked and talked about at the federal level, we today remain authorized within the Developmental Disabilities Act as a self-governing organization charged with identifying the most pressing needs of people with disabilities. And in states and territories, there are 56 councils across the United States and its territories. And our work is to address those needs of people with disabilities and their families by conducting activities that include advocacy, systems change, and capacity building that ultimately promotes self-determination, integration, and inclusion. Our key activities include conducting outreach, providing training and technical assistance, removing barriers, developing coalitions, encouraging citizen participation, and keeping, as we see today, policymakers informed about disability issues. We are not only proud to be an organizing entity in supporting the New Jersey Legislative Disability Caucus, considering our scope of responsibility, but we're equally appreciative for the collaboration among supporting organizations that share the value and significance of working with our elected officials in the most significant issues that face people with disabilities. You've heard a lot of sombering moments today, but I think it just underscores the commitment and the passion with all of the speakers we've heard from. As it relates to the federal and state budget for the council, our greatest concern is that we continue to fulfill our role within the Developmental Disabilities Act, given the budget uncertainty, and that we help people and their families access the services and supports that they rely upon. The greatest fear of a family member of someone with a disability is what will happen to my loved one when I am no longer here. The greatest fear of a person with a disability is what will happen to the caregivers that support me if changes occur within the system. Will the modest lifestyle of having an affordable apartment, assistance with rent and utilities, and transportation to go to the doctor, to go to the grocery store, and to have the trained caregivers remain intact, will it crumble and will it fall apart? Living with disabilities often feels like living on the edge of a cliff, and just one small jolt will throw everything off balance. Stability is more than a hope and a prayer. It's a requirement for safe and healthy living. Every decision that is made needs to be carefully evaluated. Policymakers and budget offices need to understand that the short and long-term impact of changes that can take place that can be reduced or eliminated today does not have a more costly financial and health outcome implication for tomorrow. So we are at the top of the 1 o'clock hour. We try to really keep our sessions on time. I did see one comment in the chat. Thank you. I think it was Assemblywoman Fantasia, but I can't see the full name. But I think that was you. Appreciate your comments. Appreciate the time that all of you have taken today to listen to the supporting organizations. Remember that these are all resources to you and your legislative offices, to your staff. We know how often we get called at the council upon your offices, and I know the other organizations do as well. We're in this together. We are stronger when we're together, and we look forward to maybe a more uplifting session at our next meeting on July 22nd, 2025 at noon. So we will see you then. Thank you all.